Hi, it's Tracy with the Cuga Economic Development Agency and Cuga County Chamber of Commerce. I am back with an FAQ, and today I wanted to talk about the cluster strategy that the state has implemented to focus on outbreaks of COVID. You may have been hearing about it over the last couple of days because Onondaga County next door did have a section of the county put into a yellow zone. So I just wanted to go over what this means for Cuga County and what we need to be keeping an eye on. First, all of the information about this strategy is on the website forward.ny.gov. Some of it's a little harder to find than other pieces, but it is all there. The second thing to know is that the state is broken down into tiers. Cuga County is in tier 3, which is actually a different tier from Onondaga County. Tier 3 is communities that are between 50,000 and 150,000 people in population. And Onondaga County is actually in tier 2, which is the next level up. These tiers actually have different thresholds. So just know that Cuga County doesn't have the same threshold as Onondaga County. The second thing to know is that they've created zones to help control outbreaks of COVID. There are 3 zones, yellow, orange, and red, and each of them comes with a different level of restrictions to help stop community spread. The yellow zone is the precautionary zone, and that has relatively fewer restrictions, whereas the red zone is more or less a complete shutdown like we saw earlier in the year where only essential businesses are operating. For Cuga County and Tier 3, the threshold to go into a yellow zone is a 7-day rolling average positivity rate of 3.5% for 10 days. And they also look at the number of new daily cases per 100,000 residents. To go into an orange zone, it would be 4.5% positivity for 10 days. And for a red zone, it would be 5.5%. The state is also considering other factors like if there's actually a low number of new cases or increasing hospitalization rates, or if they can clearly identify a specific institution where an outbreak is occurring, that might not lead to a whole community going into a yellow zone. It might just lead to more resources to help stop the spread within that institution. That might be a college, a jail, a nursing home, something like that. These zones, again, have varying levels of restrictions. The yellow zone really mostly affects mass gatherings and worships. Schools can remain open, but they have to increase their testing rates. Dining can still happen indoor and outdoor, but there's a 4-person maximum per table, and restaurants and bars need to close at midnight. Most businesses can stay open. But mass gatherings are reduced to 25 people maximum, and worship is reduced to a 50% capacity. So that's really where we see the main differences in the yellow zone. The orange zone, it ups the ante. The schools need to go remote, outdoor dining only. Again, the 4-person maximum. High-risk businesses need to start closing, like gyms and salons, personal care businesses. Mass gatherings are reduced to 10 people maximum, and worship is reduced to 33% capacity and a 25-person maximum. Red zone is really where we see that shutdown, like I mentioned before. Essential businesses only, takeout and delivery for dining only, mass gatherings prohibited, that level of restriction. But this is really the zones where there's a major community spread outbreak. Once a community is put into a zone, 14 days after that point, the state health department with local officials will decide whether or not to change the zone or remove the zone. This again is based on a decline in positivity over a 10-day period and going below a certain threshold of positivity rate for 3 consecutive days at the end of that 10 days. To get out of the zones completely, an area needs to hit a 2% positivity rate on a 7-day rolling average for at least 3 consecutive days. And the orange zone is a 3%, red zone 4%. So really it's, again, thresholds you need to get below to get out of the zones. Again, the state will look at various things in addition to those rates. like trends in hospitalization and new cases tied to specific facilities, that kind of thing, when making those decisions. Really, we need to be paying attention to community spread to avoid going into these zones. Another thing to know is that they are also creating buffer zones. So a community that is put into a yellow zone, their neighboring communities might also be put into a zone to help prevent spread around that community. So it might be a yellow zone with a buffer zone around that is yellow, or an orange zone with a yellow buffer zone around it. So just know that what our neighboring communities are doing could affect what happens in our community as well. So pay attention to mass or going to events with large groups of people, keeping your distance, wearing a mask, because we really want to try to avoid getting into these zones and seeing additional restrictions in our communities. That's all for today. Have a great day. Keep an eye on these numbers, and we'll see you again soon.